Hey guys, welcome to another video. Today our topic is on congenital hypothyroidism. We'll be talking about the symptoms, treatment, and complications of congenital hypothyroidism. So let's get started. So what is congenital hypothyroidism? Congenital hypothyroidism is basically a condition in which a newborn baby is born without a fully functioning thyroid gland or with a thyroid gland that does not produce enough thyroid hormone. The thyroid gland, as we all know, is a small butterfly-shaped gland located in the neck that produces hormones that regulate metabolism and growth throughout the body. There can be several causes of congenital hypothyroidism, including genetic factors, thyroid gland dysgenesis, and thyroid hormone synthesis defects. In some cases, the condition may be inherited from a parent who has a thyroid disorder. Other causes may include iodine deficiency during pregnancy, exposure to certain drugs, and radiation exposure. Thyroid gland dysgenesis is the most common cause of congenital hypothyroidism, accounting for about 85% of cases. This occurs when the thyroid gland does not develop properly during fetal development and may result in a small or absent gland. Thyroid hormone synthesis defects, on the other hand, occurs when the thyroid gland is present but is unable to produce enough thyroid hormone due to a problem with hormone synthesis. It is important to note that congenital hypothyroidism is a relatively rare condition affecting about 1 in every 2,000 to 4,000 newborns worldwide. However, early detection and treatment are crucial for preventing potential complications and ensuring optimal growth and development. Now coming to the symptoms of this disease. The signs and symptoms of congenital hypothyroidism can vary depending on the severity of the condition and the age at which it is diagnosed. Some of the common signs and symptoms of congenital hypothyroidism in newborns may include difficulty in feeding, constipation, jaundice, low body temperature, swollen tongue, lethargy or decreased activity level, puffy face, and delayed growth and development. If left untreated, congenital hypothyroidism can lead to intellectual disability and other developmental delays. Congenital hypothyroidism is typically diagnosed through newborn screening tests, which are done shortly after birth. Most states in countries such as the United States and many other countries require newborn to be screened for congenital hypothyroidism. The screening involves a simple blood test that measures the level of thyroid hormone or thyroid stimulating hormone in the baby's blood. If the results of the screening tests are abnormal, further diagnostic tests can be done, such as a thyroid scan or ultrasound, to evaluate the size and function of the thyroid gland. It is important to note that congenital hypothyroidism may not always be detected through routine newborn screening, and parents should be aware of the signs and symptoms of this condition and talk to their healthcare provider if they have any concerns about their baby's growth and development. Once diagnosed, congenital hypothyroidism is typically treated with hormone replacement therapy to supplement the body's thyroid hormone levels. The goal of treatment is to provide the baby with enough thyroid hormone to support normal growth and development. The most common treatment for congenital hypothyroidism is daily oral administration of synthetic thyroid hormone called levothyroxine. The dose of levothyroxine is based on the baby's weight and is typically started at a low dose and gradually increased over time. The treatment is usually continued for life, and the dose may need to be adjusted periodically based on blood tests to ensure that the baby is receiving the appropriate amount of hormone. It is important for parents to understand the importance of giving the medication to their baby as prescribed and not missing doses. Even a small interruption in treatment can have significant impacts on the baby's growth and development. In addition to hormone replacement therapy, babies with congenital hypothyroidism may require monitoring and management of other health issues that can be associated with the condition. This may include regular checkups with a pediatric endocrinologist, monitoring of growth and development, and screening for other health conditions. Parents of babies with congenital hypothyroidism should always be aware of the signs and symptoms of underactive or overactive thyroid hormone levels and talk to their healthcare provider if they notice any changes in their baby's behavior or development. With proper treatment and management, most babies with congenital hypothyroidism can lead healthy and normal lives. Now, finally, coming to the complications. The long-term outlook for individuals with congenital hypothyroidism is generally good if the condition is properly managed. With early diagnosis and appropriate hormone replacement therapy, the majority of babies with congenital hypothyroidism can achieve normal growth and development. However, if the condition is not properly managed, it can lead to serious complications. Some of the potential complications of untreated congenital hypothyroidism include intellectual disability. Thyroid hormone plays a crucial role in brain development, and untreated congenital hypothyroidism can lead to permanent intellectual disability and developmental delays. Second is growth delays. Untreated congenital hypothyroidism can also lead to poor growth and delayed development of physical features such as teeth, hair, and nails. Fourth point is delayed puberty. In some cases, untreated congenital hypothyroidism can lead to delayed puberty and other hormonal imbalances. Lastly, we have, in rare cases, untreated congenital hypothyroidism can lead to other health problems such as heart defects, hearing loss, and vision problems. But this does not happen that often, it is quite rare. To prevent these potential complications, it is important for babies with congenital hypothyroidism to receive hormone replacement therapy as prescribed and to undergo regular monitoring of thyroid hormone levels and growth and development. Parents should always be aware of the signs and symptoms of underactive or overactive thyroid hormone levels and talk to their healthcare provider if they notice any changes in their child's behavior or development. Now, with proper treatment and management, most babies with congenital hypothyroidism can lead healthy and normal lives.